Hi, we are a group of dental hygiene students from Foothill College, and many of us are also moms. During our community service in the past year, we helped with dental screening events in many elementary schools in the Bay Area. During the dental screening, we encounter many children with severe dental cavities. As moms, it hurts our hearts to see those young children suffering from oral disease, which could have been preventable. So we decided to do something to help those young children improve their oral health and end their suffering. We did research and found that educating parents of young children is the most effective way to improve the oral health. So we designed the Parent on ECC Dental Health Education program to help teach parents about oral health to reduce early childhood caries among children under 6. So here's our program. So, early childhood caries is a major oral health problem in the United States and worldwide. According to the Global Burden of Disease study in 2017, more than 530 million children globally have dental caries on their primary teeth. In the United States alone, 1 in 6 children aged 2 to 5 was found to have caries between 2015 and 2016.
Early childhood caries is defined as the presence of one or more decayed, non-cavitated or cavitated lesion missing due to caries or filled tooth surfaces in any primary tooth in a child under the age of 6. Early childhood caries has significant influence on children and their families as well as the society. The disease affects children's oral health and general health, compromises their ability to eat and sleep, and restricts their daily activities and school attendance, as well as interferes with their speech development and other aspects of social development. Early childhood caries brings economic burden to families and the society. Treatment of early childhood caries can be costly, especially when early childhood caries progresses to an advanced stage and extensive dental repair needs to be done under general anesthesia. Early childhood caries differs from caries in older children and adults in its rapid development, diversity of risk factors, and strategies of control. The causes of early childhood caries are multifactorial and strongly determined by socio-behavioral, economic, environmental, and societal factors. Major contributing factors to early childhood caries include improper feeding practices during early childhood, familial socioeconomic background, lack of parental education, and lack of access to dental care. Almost all the risk of factors for early childhood caries are modifiable, though. Strategies of prevention and control of early childhood caries are developed aiming at management of the risk factors of early childhood caries.
Early childhood caries is prevalent in socioeconomically disadvantaged populations. A prevalence of up to 85% has been reported for disadvantaged groups. Prevention and control of ECC is a complex process that involves multi-level community and societal efforts. Successful strategies of ECC prevention and control feature effective utilization of education or prevention platforms and tactful management of behavioral, cultural, and environmental risk factors.
Educating parents on children's oral health can raise awareness of early childhood caries and facilitate behavioral changes towards early childhood caries prevention and control. Parents have a direct influence on their children's oral health. The family is the children's primary source of learning about health and risk factors. Parents' oral health knowledge, beliefs, and attitudes have a direct influence on their children's oral health maintenance, dietary habits, and oral health behaviors. Parents play a pivotal role in all aspects of prevention and control of early childhood caries. This is why we use parents' oral health education as the first line of defense in early childhood caries prevention. Parents on Early Childhood Caries Dental Health Education Program. Dental Health Education Program took place at Canyon Heights Academy in Campbell, CA. The participants were a group of 12 parents with infants to pre-kindergarten children. In this study, we want to find out whether presentation on oral health to parents with children under age 6 increase their knowledge of oral health care for their children.
A pre-survey was conducted among the participating parents about their oral hygiene knowledge and habits as it stood currently for their children. A short PowerPoint presentation on oral health was given to the parents. The content of the presentation included information on early childhood caries, how to check and clean baby's teeth, healthy food for teeth, how to avoid baby bottle teeth, taking children to a dentist, and protecting teeth with fluoride and sealants. A poster survey is done to see if parents' oral hygiene knowledge has increased. Here are the results of our study. We can see that parents' oral health knowledge on most of the topics we presented increased significantly after the presentation. For knowledge on brushing teeth, only half of the parents answered the pre-quiz correctly, while 90% parents answered the post-quiz correctly. For knowledge on fluoride, only one-third parents answered correctly in pre-quiz, while 80% of them answered correctly after the presentation. For knowledge on seeing a dentist, healthy food for the teeth, and flossing, we've seen 50% or more increase in knowledge comparing pre-quiz and post-quiz results. The greatest increase in knowledge involves topics related to sealants and baby bottle decay. Less than 20% parents answered correctly in the pre-quiz, while after the presentation, 70% parents answered the sealant questions correctly, and 100% parents answered the baby bottle decay questions correctly.
Our program showed that a presentation on oral health to parents with children aged under 6 can significantly increase their knowledge of oral health care for their children. Our program can serve as a pilot program to create a replicable oral health education program targeted at parents with children at risk of ECC. We hope this program can bring new lights on oral health education pertaining to ECC and open up more discussion on prevention and control of ECC. These are our references. Thank you for watching.